Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello everyone and welcome to Sensei podcast. It is my great pleasure to introduce our guest today, Dr. Kalaivani Mahadevan. Vani, thanks again for joining us today. I know you have done a lot of work in the UK and we're delighted you're part of the podcast.
Thank you very much, Manos. It's such a privilege and a real honor to be here. So thank you for the invite. Thank you for having me.
Well, it's a pleasure. And maybe we'll start about the beginning. How did you get motivated to get into this area of complex CTO PCI to start with?
So, for me in the UK, we go through a training program. We do our general cardiology residency, as you would call it in the States. And then we have 2 years usually of subspecialty training. And the subspecialty training usually makes you good enough to be sort of a general interventionist. For me, when I completed my subspecialty basic training, I took a 2-year fellowship at the Bristol Heart Institute. And that's where I think I really developed a passion for complex high risk and CTO PCI. And I think for me, it was more about being able to address the needs of as many patients that came to me as possible. And to be able to complete procedures for them in a safe and effective way without turning them down because I felt like the jeopardy was too high or because I felt like my personal skill sets weren't good enough. So the whole process for me is about growing every day and learning and developing new skills and, honing in the old skills and making sure you're up to date. So that the Bristol Heart Institute was what really got me into the kind of space of wanting to become good at complex and CTO PCI.
So it was seeing other people. Did you knew you want from before that you wanted to follow this pathway, or it just happened that you were there and you got inspired from the people around you?
I think a little bit of both. I think I really enjoyed the idea of the complex space before I started there, but I had 2 fantastic mentors during those 2 years, Tom Johnson and Julian Strange, and they both have impacted massively on my career as an individual. And I think they showed me things that were possible and ways of doing intervention which were cutting edge and innovative and optimal. And that gave me an inspiration to want to become like that. Of course, everybody knows, both of them. Tom is, very advanced in the field of intravascular imaging and in bifurcation and complex and chip PCI. So I kind of learned lots of imaging skills from him and he trained me. And so now I often image in a lot of my cases. And then, of course, from a CTO perspective, Julian was the inspiration for CTO and going down the CTO pathway. So I'm actually very grateful to both of them. They were, they showed me that there was a pathway that I hadn't realized potentially existed and started me off on that journey.
Perfect. There's nothing like, seeing, I guess, what is possible, as you say, and get the bug. But again, from getting the bug and wanting to do it to actually starting doing, then there's a long way over there. And there are many discouragements. It's an extra training potentially. And then there's the stress, right? You're now doing cases that are much more complex, more risk of failure. Does that bother you? Do you thrive on that? How?
Yeah, that's a really good question. A bit of both, I think. I think for me, when you have a complex case, the first thing to do is to make sure that the indication's correct. If I know that I'm putting a patient on the table and the indication is sound and robust, I feel less nervous. I think communication is key with the patient and the family. So going through the potential risks and making sure that you've medically optimized them first and making sure that you're going to make a difference to their quality of life or their prognosis. So those 2 things. I think in the CTO space, there's a lot of, non-CTO operators that will say, well, you're not going to make them live longer. You're not going to stop them having an event. And, there's a lot of that. But for me, in some ways, you have to then take that sort of debate as to, is it more important to live 10 years, but in pain or not able to do the things you want? Or is it more important to live a shorter time, but actually with an excellent quality of life? And so I think when we filter patients for CTO PCI or CHIP PCI, it's important to filter them in a way that you feel that you're going to improve their quality of life and that that's something that the patient wants. So if the indication is sound, I think internally I feel much more confident that I'm doing the right thing. And then before the case, it's all about sort of preparing. So, looking at the images well, having a plan A and a plan B, and then sometimes a plan C. What am I going to do if I can't cross? What will I do if this goes wrong? What potential complications might happen and how might I manage them? And then the third thing is building your team. So making sure when you bring the patient that day that you have the right nurses, the sort of right physiologists, people with the correct experience. And then I think when all three of those things line up, I enjoy the procedure and I don't feel too nervous about it. And I think once you start, you kind of go on to autopilot. So you're so engrossed in actually doing the case that you lose your nervousness. And then obviously when you complete, you're happy. I think if one of those three things doesn't exist, the indication or the team or the preparation, I think that's when you have to feel more concerned that and nervous that you might mess up.
How long do you take to plan and look at the films and prepare your thoughts for the case?
Depends on the case and it depends on the patient. So it depends on the complexity or the nuances of the case. I will often seek another colleague to go and brainstorm with because I genuinely feel that multiple heads or thoughts are better than one. And I'm very lucky I have quite a cohesive unit. So most of my colleagues are very nice. And so I will go to some of them and say, what do you think? What might you do here? What do you think might go wrong? So I think that's important. But I think the amount of time you spend is dependent on the nuances of the individual case. So some high-risk cases, yes, they're high risk, but actually you have a plan and it's quite a robust plan. And then other cases, for example, some of your CTO cases where you don't have good collaterals or you're not sure whether you're going to cross or, you might take more time trying to work out, well, how am I going to do this?
Now, let's say you did the best effort and you plan carefully and you have the team involved and everyone's on the same page, things are going well, but then inevitably, sometimes things will not go the plan way, right? And this is one of those moments that many people actually are so afraid that they actually don't even go in the field. Instead, they prefer to do more routine cases rather than expose themselves to the increased risks. How do you handle that and how big has that been a factor in deciding to follow that area of intervention?
Yeah, that's a great question. It's quite a tough question as well. I think fear is our biggest sort of obstruction. And I think one of the important things about getting over the fear is, first of all, ensuring that all of the other factors are correct. So your indication, your team, preparation, having colleagues around. And secondly, having a belief that you can do something, but also knowing that you can handle things when they go wrong. And that comes from developing skills. And sometimes those skills you don't automatically develop until you've had the complications. So you have to do simulation training. And so I think things like the complications courses, the simulation training courses that we do can be very good to help you to prepare for complications. So, Build is a fantastic complications course, which you've previously been involved with. And EuroPCR, so the Europeans have a complication and coronary bailout session, which I sometimes train on as well, so educate on, but with simulation models where you can simulate distal wire perforation, you can simulate stent loss and things like that. And I think the simulation puts you through the key processes so that if you then have a complication that you haven't come across before in the lab, at least the thought processes and the stepwise algorithm is there. You then just need to enact it in a real person rather than on a simulator.
How long does it take you to bounce back? So let's say you have a complication, something bad happens. Do you carry this for days, weeks, months? Do you get over it? How do you get over it? How does it affect you?
I think some complications stay with you forever, actually. I remember being a fellow, and I had quite a really lovely gentleman turned down for surgery. He had had multiple stents, and he had a left main dissection. And it was my guide catheter that I had put into the left main. He had severe in-stent restenosis, severe LV, pulmonary hypertension, and no reserve. And he arrested on the table. And it was really difficult. It was the first time I had actually cried in the cath lab. It was the first time I'd had a death at the end of my own case or procedure. And we tried everything, we tried to stent the left main. We put a Lucas on and did CPR whilst trying to get flow back, but we didn't. And, I didn't want to go back into the lab for a while, actually. But I had a very supportive attending team who said, complications happen, these things happen. And if you want to be an interventional cardiologist, you're going to have to be able to deal with this, and you have to get back on your bicycle and pedal again. So 2 days later, I was pushed back into the cath lab by my trainers. And I said, I was quite nervous. So I said to the boss, can you just stay while I put the guide in? Just stay in the room. And he said, no, you don't need me. And he walked out. And I put the guide in and I put the wire down and I did the angioplasty and everything was fine. And I think for me, that was the biggest thing, is that, bouncing back, you need support. If you work in a unit where your colleagues are supportive, if you've got, supportive friends in the interventional field that you can call up and talk to when you've had a bad event, and also learning, what can I do differently next time? Maybe I can manipulate the guide catheter differently. Maybe I was too aggressive. Maybe I should have taken a different guide. Maybe I should have had a wire in the end of the guide before, so that when I engage, I could quickly wire the vessel. So I think all of those things are learning points. But I think the things that help you bounce back are a growth mindset and really supportive colleagues.
No, absolutely. And this, what you just said, happens to everyone. If it hasn't, it will, if you stay on this work long enough. So this is something not uncommon, but you're right. It's very different, and the environment does play a huge role. There's also this bias, right, that the last case dictates, like we say, anatomy dictates strategy, same thing. The last case dictates the next case. You're so preconditioned, like whatever happened, although it's not rationality at all, but there's this thought that you may have it. But having supportive colleagues is important. Do you like to discuss about these cases? Are you more introspection? What is your approach to when this happens? Is it sharing with other people? Some things you have to share, but the saying is, do you prefer to share with other people or more to kind of look into, think about it yourself?
No, I'm a very sharing person. So if I have a complication or something goes wrong, the first thing I'll do is go around and tell everybody and ask them to look at the films, because for me, the most important way for me to move forwards is to understand that I've learned something, because I don't want to make the same mistake again if I've made a mistake. Now, sometimes, of course, it's not inherently that you did something wrong. It's just that it was a difficult case, or the patient was very sick, or that, you were unlucky. But for me, I will share it with my colleagues and seek other opinions, seek advice. And I think that's important, because it gives me a sense of resolution in my mind in terms of, could I have done something differently? If the answer is yes, then how do I incorporate those other techniques or thought processes into my practice going forward, so that if this happens again, because it's likely to over the time period of your career, how will I manage it differently to get a better outcome next time? And if my colleagues and you brainstorm with your colleagues and they turn around and say, no, do you know what? I don't think you could have done something differently here. You were just unlucky, or this was a really sick patient and the chances of them having a good outcome were very poor from the offset. Then I'll walk away feeling a little less sort of angry or upset at myself. So I think for me, sharing is very important.
Wonderful. And I agree. I think sometimes if you keep it just bruised up, takes more dimension than it should, and then you feel plus, you're right, you always learn from something, and everything happens for a reason. Now, when it comes to learning all these techniques, making you're fortunate to train some of the best in the world, what did you find the most difficult thing to learn? Was it technique, or was it the manipulation of the equipment, or was it the thinking process? What was the thing that you found the most challenging?
If I think back to my fellowship and training, I think one of the hardest things which is underrated is strategy, the thought process of how to approach how you're going to revascularize something. Because I think inherently most people can be taught how to use a microcatheter, how to balloon anchor, how to use a guide extension. And if you've got a good teacher, they can teach you the practicalities of being able to do most of those things, how to cross a septal, how to stick and swap. But the thing that is harder, I think, to teach is how to have a good strategy, how to approach a case in a logical way. And I think that that's something that algorithms have helped us with over the course of the last decade. So, CTO hybrid algorithm, the calcium algorithms, and imaging has obviously shed a lot of light on how you strategize, how you perform a PCI. But I think the thought process is one of the hardest things. And I think if you look at the operators who really truly get the best outcomes, many of them have very high level thought processes. And the angioplasty comes naturally, but having your plans and your strategies and being able to think as you go along and change your plan as you go along, because of course lesions and patients don't behave the way we want them to sometimes. So being able to be flexible and malleable and change within seconds your strategy and think of new techniques as you're going through a procedure, I think are the hardest things to teach and learn.
Yeah, absolutely. I think that's something that everyone matures and gets better and better. There's no perfect person on that. In terms of the team, how is the team? Is it supportive? Is it not? Do you have to train them to do these cases where they could? I mean, how does the team play a role in how you do the procedures?
Oh, I think the team are fundamental. And I think in sort of complex PCI, the team are everything in some ways, in many ways. So, they are your second pair of hands, they are your second pair of eyes, they are your second pair of ears. And I think in complex cases, as an operator, you get very focused on the case. Your eyes are glued to the screen and your fingers are working and your thoughts are all about the angioplasty. Now, we do have to be able to multitask to an extent, of course, but, if we could do everything by ourselves, we wouldn't need the rest of the team. And so I think in a complex intervention particularly, but in all interventions actually, you need a good physiologist that can tell you when your blood pressure's low, can tell you when you've got an arrhythmia or when you've got ectopics and your wire's about to go out the end of a vessel. That helps to mitigate a complication. And sometimes very experienced scrub nurses pick up things before you do. They'll say, "Are you sure you want that?" Or, "You haven't done an ACT for 30 minutes. Don't you want an ACT now?" And, those are really helpful things. So I think empowering and training the lab team to be good at taking on complex cases is fundamental to the success of the overall case, I would say.
And then how do you make them, or what is your approach? Do you make them feel at ease? You're going to kind of run a tight ship, so to speak, in the cath lab? How do you handle this sensitive balance there?
Yeah, that again, a really good question, because most of the time the lab has quite a jovial environment. We talk about what we did at the weekend, we talk about, movies that we might have watched, and you can't have a serious atmosphere in the lab all the time because we all work in the lab constantly. And it wouldn't be, I think, a pleasant working environment if everybody was silent the whole time. So we do have music sometimes in the lab and people talk, but part of our checklist in the morning, and we do a team brief every morning, so human factors type team brief. And part of that checklist incorporates something that came from the aviation industry called the sterile cockpit. And so part of our checklist is that when we go through in the morning, we check everybody has their radiation badges. We go through all the patients, what equipment we need for those patients. We go through the bailout kit to make sure that if we have a complication, we've got the right stuff to deal with it. We go through training and learning needs of each of our staff. So everybody gets asked, what are you going to learn today? What are you going to improve on today? And everybody has to say something. And then as the operator, it's my job to then try and help them to learn something. And one of the things is the cockpit mode. So we have an understanding that if we have a complex case, or if we have a patient that's becoming unwell on the table, or if we have a complication, that we go into something called the sterile cockpit mode, which means that everybody understands that we're no longer in our normal working mode of, being relaxed, but we're in a hyper-vigilant mode where they need to flag up everything and be super focused. And that means, guys, something's not right. So that's how we deal, I think, with having a chilled environment in the lab 90% of the time. But when we really need to, we revert to a hyper-vigilant mode and super focused, if that makes sense.
That's actually impressive. I know we do the timeout, but this is mainly, okay, is the right patient on the table more so, and what procedure we're doing, but we don't go through all the learning objectives for the day, which I think is a great way to do it. And we don't, I must admit, necessarily check every day, hey, is the cover still on the shelf, or is the coil there? I mean, we assume it's there. But you're right, sometimes you do get surprised. So doing it in a more consistent basis might provide some good benefits. Now, in terms of again, functioning under this stress, how do you do it? Do you meditate, exercise? What do you do? What are your techniques to keep the calm during all these tough moments and to be fit in general?
So I have three things actually that I couldn't live without, other than angioplasty. They are exercise, travel, and music. They're my kind of anchors that keep me sane, I guess is the right word. So I have a piano at home. And pretty much every day now after work, when I go home, I go straight to the piano. I'm not particularly good, but I can play. So, and I don't have, I put the dampened sound pedal on so I don't disturb the neighbors too much. But that keeps me happy, I think. And it allows me on a daily basis to let go of any stresses that I faced at work that day. So I'll sit and play the piano for 45 minutes or an hour, and then everything that was not good is now no longer a problem for me because the music takes that away for me. I exercise usually 3 to 4 times a week because exercise is a really big part of who I am. And that, I think, again, allows me to let go of stress and to feel good and healthy. And then traveling, which obviously you can't do that every day or every week, but I like to travel to quite remote places and be at one with nature. So kind of every 6 to 12 months, I will do what I call a little adventure somewhere. So 2 years ago, it was the Arctic to a place called Svalbard, which is a little archipelago just north of Norway. And last year, it was Antarctica. And on the back of CTO Plus, I've got my backpack and I'm about to go off to Greenland. So,
oh my goodness.
So I usually go for maybe 7 to 10 days. I don't have internet access. No one can call me on my mobile. And that gives me my energy back to kind of recharge in the solace of nature and the snow.
Well, you must come to visit Minneapolis if you enjoy the cold. I mean, with the perfect place. It's not like the poles, but I think it's getting close.
Do you have snow?
Normally we do have a lot of snow. This year it's been a little less so, but yes. But it's interesting. It's a good thing you're going now because the way this is going, Arctic won't exist for much longer.
No,
so it's
absolutely.
a good to go there. The same for Greenland, I guess. What exercise do you do?
Depends. So at the moment, I'm mainly at the gym. So I'm doing something called high intensity interval training. So HIIT training, which is supposed to be good for cardiovascular. And it's just a bit more interesting than just running. But I do also go on the treadmill and the cross trainer. I am about to get a kayak because I like kayaking, and a road bike because couple of my siblings and sibling brothers bike. And they keep saying to me, you should get a bike, it'll be good for you. So I'm about to start doing that. And they promised to teach me in return for chicken biryani. So if I cook them a chicken curry every so often, they'll give me bike lessons. That's the deal.
Sounds like a good deal. So how do you manage all this time? Because obviously you have a busy job and other things that you do as well. How do you manage your time so you can get to the piano and get the exercise and do the cases and keep in balance?
Sometimes I don't manage my time very well. Some weeks are better than others. I think you have to look at your work schedule. And, there'll be some weeks of your work schedule where it'll be impossible to do all of those things. And there'll be other weeks where perhaps you're freer. Traveling, of course, is done in annual leave. So when you take your holiday time.
Sure.
But the others, are just kind of done around work. So the gym is empty at 6 a.m. So there are 2 or 3 days a week where I wake up at 5 and go down and do the gym and then sit in the spa. They've got a nice steam room, have a shower, and then I can be at work. And if it's an admin day or a clinic day, I can start an hour later. If it's a lab day, I start an hour earlier. So just scheduling the exercise onto days where I don't have to be at work as early help me to be able to achieve those goals.
And then how many hours can you sleep every night?
That's a good question. When you're on call or not on call?
Say both directions. I guess when you're on call, it's very unpredictable. Let's say when you're not.
When you're not on call. I used to not sleep so much. I used to sleep about 5 hours. But over the last 6 months, I think I've taken more of an active effort to sleep for longer. So I probably get around 6 to 7 hours a night, which is good for me as an individual. But I think we all need different amounts of sleep to function.
That's true. And again, everyone says how you feel. You feel better if you're sleeping more, you think more energy or feeling better overall?
I think there's a certain, I think somewhere between 6 and 8. And if you don't get that for most adults, it's not good for you. But I think anything less than 6 is difficult and not good for health. So we all need to try and get decent sleep.
I think you're absolutely right. It's always a challenge these days, but that's the ultimate goal. Plus, it improves your efficiency for the rest of the day, so you can actually be more productive during the rest of the day.
Very true.
Now, what is your favorite book or movie?
I don't think I have one favorite movie. I think I have probably a few. When I was younger, my favorite movie was Robin Hood, Prince of Thieves, which is, I'm sure you guys have heard of, but the concept of, this hero that, sorts out all the bad people and takes from the rich and sorts out the poor was something that I think resonated with me then. Plus, my mum went through a phase where she just loved Kevin Costner movies. So when I was a teenager, the house was full of Kevin Costner movies and Robin Hood was one of the best ones. So I watched that quite a few times. Recently, I would have to say my favorite movie is actually a Bollywood movie made in India called Purna, which is a movie about a young girl from a village whose parents were agricultural farmers from South India, who was desperate to get herself educated. And of course, many girls in South India end up not getting an education. And she ended up in a government school and developed a love for climbing. And in a year, she went from being a farmer's daughter in a remote village to being the first female, or the youngest female actually, to summit Mount Everest at 13 years and 11 months. So she actually climbed to the top of Everest. It's a real life story. It inspires me every time I watch it. It makes me cry when I watch it. I'm coming across as a real crybaby. I'm not. I don't cry that much. But it does bring a tear to the eye because it's incredibly inspiring. And I think as we get older in life, I think we always look upwards to people who are elder to us for inspiration. But actually, I think you can get a huge amount of inspiration from people who are far younger than you, and age doesn't matter. It's the story that matters. And her story inspires me every time. So that's probably my favorite movie now.
Perfect. And actually, I think that's part of the Sensei. Get all the stories and inspire people so they can follow the footsteps. Now, how about the things that you're doing? What excites you the most right now in terms of, both professionally and personally?
Learning, I think, excites me the most. And it doesn't matter what specifically I'm learning. I just have to be learning something new, whether it's a new hobby, whether it's learning to do a new skill like, swimming or climbing or mountaineering, or whether it's learning a new skill in the Cath lab. But for me, I'm happiest when I'm learning. And if I'm not learning, I start to feel a bit miserable. And I'm not sure whether that's a good thing or a bad thing. I think in some ways it can be a bad thing, because it means almost that you never always feel satisfied. Because if you're always looking to learn something new, then perhaps you're not content. That's one way of looking at it. But for me, the process of learning something new excites me. So I have to keep learning.
So what are you learning right now?
So I'm going to learn to bike, as I said.
Okay.
And then I have, in my unit, we don't have laser atherectomy. So from a procedural standpoint, I don't use it. But I have an incredible mentor who's been a mentor for 10 years, Peter O'Kane from Bournemouth in the UK. And I have a stent failure case. So I phoned him up the other day and said, can I bring my case to you and can you proctor me to do laser? He said, yes. So I'm going to hopefully, fingers crossed, go and do a laser case with him. And then orbital is the other thing that was on my list of techniques to learn. Of course, you guys have done thousands of orbital cases over here. But in the UK, we were late coming into orbital atherectomy. So we haven't got the experience you have, and that's something I want to learn. So I've just done a very small number of cases and want to improve my caseload. So that's the other thing I'm trying to learn. And then, of course, CTO PCI is a learning journey. You can learn for 20, 30 years and still not be finished in some ways.
That and everything else, actually, but you're
Yeah,
right.
that's
Especially
true.
CTO-PCI is one of the areas that it's more so. And what are the things that you're most proud of that you've achieved so far?
I don't think I can name a single thing that I'm proud of. I think I would say I'm proud of the journey. So I think if I look back to where I was and where I came from and where I am now, I think I would say that I'm proud of the progress as a concept. I don't think I can put my finger on one thing and say I'm proud that I've done this or I'm proud that I've done that, but I'm proud of the concept of the journey that I've been on and to the place that I've got to from where I was.
And what are you planning for your journey in the next 5 to 10 years?
That's really interesting. Well, I had a goal to make sure that I had traveled every continent before 40. I didn't achieve that goal because COVID ruined it. So I lost 2 years of traveling because of COVID, but I've done 5. So I'm hoping that in the next year or 2 that I can see Australia and Africa, and then I'll have achieved that goal of having set foot on every continent. The other one is Everest. So I'd love to go to Nepal and do Everest base camp. So that's the other thing in terms of travel goals. In terms of personal goals, seeing family more over the next 3 to 5 years. I think probably over the past 5 years, I have been so engrossed in career development that I haven't spent as much time with my family and friends that I should have done. I'm very lucky. I have an incredibly supportive network of family and friends. So despite my frequent absences, they don't get cross with me and they still support me. So that's a good thing. And then from a professional or career perspective, developing my skills in this space, in the chip and CTO and complex space, and trying to develop some academic and research progress. So, I'd really like to kind of run my own trial one day and sort of take academia forwards, particularly in things like out of hospital arrest and shock, because I think that's where the greatest mortality lies and where we can make a big difference, but also in the complex and CTO space.
Perfect. Well, you have your plate full. It looks like it's a lot of great goals, but I love your thought, about learning being the goal. And actually, this is the goal of the podcast. I think that one of the key goals in life. Now, but when you learn, how do you learn best? Are you a visual person? Are you learning by seeing, learning by doing? What are the things that help you learn, not only the PCI, but the other things that you're doing in personal life, piano, for example?
I think I learn by doing, but I think having the knowledge is important. So some people say, well, you can't learn by reading a textbook. I agree. But I also don't think that I think you get a more complete learning if you understand the knowledge and then you put all of that into practice. And I think that's where proctors and mentors are very important, because often a proctor, at least the training that I had in the complex space, I never started off with a new technique and did the whole procedure from beginning to end. I was always taught a stepwise approach. So today you're going to learn how to knuckle something. Today you're going to learn how to rewire through stent struts in a bifurcation. Today you're going to learn how to put the rotablator up and exchange it out, but you're not going to actually do the rotablation. And I think learning the smaller steps, bit by bit, you automatically then develop all the skills you need to do the whole case. You don't realize it. And I think for me, that works really well. Learning little bits of a case each time, and then after 4 or 5 cases, being able to put everything together and do the whole thing independently. But we all learn differently. And I think actually, if I look at it conversely from the perspective of a teacher, I've trained now 7 or 8 different fellows across 2 different hospitals. And I think you have to tailor how you teach to each of the fellows that comes through, because everybody's learning is slightly different, and how you get the potential out of each fellow is to work out how they learn best and how you can facilitate that learning.
And how do you keep them inspired and motivated? Is there something specific? What are the things that, because this is hard, right? And you say you may have a bad case happen and then you lose your momentum and then maybe you give up.
Yeah, so how do you keep fellows motivated? I think encouragement, support, and showing them that there's so much in the world of interventional cardiology. There's so many different devices, techniques, ways of doing things, and helping them to understand that there's no definitive 100% right or wrong. That if you take 10 interventional operators and you give them the same case, mostly they won't all do that same case in the same way, but most of them will get a good result at the end. So understanding that, we all do things slightly differently, we all use slightly different equipment, we have slightly different strategies, but learning to be tolerant of other people's ways of doing things, and learning to understand that there's no single correct way, and having the humility to learn from others. And I think if you keep an open mindset, and you think laterally, and you're able to look at other operators and say, wow, that was a really good way of doing that. Maybe I should incorporate that into my practice next time. The opportunity to learn and grow is huge. And I think that keeps people motivated and inspired.
So you're more in the carrot, not the stick mode of teaching.
The what?
Which, you're more on the carrot, having the carrot, so the incentive, the motivation, the encouragement.
No, the stick comes out sometimes.
The stick comes out. Okay.
I'm not all nice. When you've lost the wire 3 times, the stick comes out. But no, most of the time it's supportive, and occasionally it's kind of more assertive. But I think you need a combination of both.
Yeah, absolutely. And you're right. Breaking it down to little steps and being encouraging. And so I think if you just always kind of critical, I can see how that might turn people off and have them lose their motivation and excitement to go forward. So speaking about the fellows again, if you have to give advice to people who are doing their fellowship now and they're considering intervention, or their intervention, considering CTO, or starting their career, since you've had all this continuum recently, what would you advise them? What are the key pieces of advice you would give them so they can be successful?
I'm not sure I'm qualified to say that, but from my perspective, I guess, have an open mind, have a growth mindset, be humble, be willing to learn from others and to accept if something you've done is not correct or could be done better. Develop good, strong bonds with mentors. I think that's one of the key reasons that I ever got to where I am now, is by having incredible mentorship. And it wasn't by many people. It was by 3 or 4 individuals through my career, but they were pillars that helped me to progress. And pushed me when I doubted myself, because undoubtedly during your fellowship, you have moments where you think, I shouldn't be doing this, or I can't do this, or maybe this isn't for me. And it's in those time points where actually mentors are the ones that can see that you're self-doubting and can be the ones to lift you up and push you forward. So good mentorship, really important. And lastly, don't make angioplasty everything. Have your other things outside it, because it makes you a better interventionist and a better proceduralist and a better clinician if you have ways to release stress and to enjoy yourself outside the cath lab. Because I think we're all very cath lab loving people. You know, it's our happy place. It's where we enjoy being, but we have to learn to enjoy not being in the cath lab too. And that means learning to enjoy activities and hobbies and non-clinical related things, and having those actually and making time for them. I think that's how we don't burn out.
So you mean there is life beyond the cath lab?
Although you come to some meetings and you think there's no life beyond the cath lab, but there's absolutely life beyond the cath lab.
No, absolutely. And I think that's a common challenge we see, especially for interventionalists who are nearing the retirement age. Having talked to several of them lately, it's a small minority that actually has cultivated that part, and most people want to keep on working forever. So, and maybe that's a good thing, I don't know, but it's interesting to hear the other perspective, that there is life otherwise, and that may sustain you when you no longer can or no longer want to be part of the cath lab.
Absolutely.
But again, Vani, again, thank you so much. Great pieces of wisdom for all the people watching, and congrats on everything you've achieved. I think you inspired many people to do their best, and the new generation now, I think, has a lot of things to learn from you. So thank you so much.
Very kind. Thank you so much for having me, and thank you for being such an inspiration and for educating so many of us with all the incredible work that you've done.
Well, thank you.
Thank you.
Thank you for listening to the Sensei podcast.